Hello friends, in this video we are going to discuss everything you need to know about kidney failures. First of all, we will discuss types of kidney failure. 5 different types of kidney failure exist. Acute kidney failure occurs when your kidneys suddenly stop working properly. Chronic kidney failure occurs over time. The 5 types of kidney failure include acute prerenal kidney failure. Insufficient blood flow to the kidneys can cause acute prerenal kidney failure. The kidneys can't filter toxins from the blood without enough blood flow. This type of kidney failure can usually be cured once the cause of the decreased blood flow is determined. Acute intrinsic kidney failure. Acute intrinsic kidney failure can result from direct trauma to the kidneys, such as physical impact or an accident. Other causes include toxin overload and ischemia, which is a lack of oxygen to the kidneys. Ischemia can be caused by severe bleeding, shock, obstruction of the renal blood vessels, and glomerulonephritis, a condition where the tiny blood vessels in your kidneys become inflamed. Chronic prerenal kidney failure, when there is not enough blood flowing to your kidneys for an extended period of time, the kidneys begin to shrink and lose the ability to function. Chronic instant kidney failure. This happens when there is long-term damage to the kidneys due to intrinsic kidney disease. Intrinsic kidney disease develops from a direct trauma to the kidneys, such as severe bleeding or a lack of oxygen. Chronic post-renal kidney failure. A long-term blockage of the urinary tract prevents urination. This causes pressure and eventual kidney damage. Now we will discuss symptoms of kidney failure. Early stage kidney failure often does not cause noticeable symptoms. According to the Centers of Disease Control and Prevention, as many as 90% of people with chronic kidney disease don't know they have it. A kidney disease progresses. Possible symptoms may include a reduced amount of urine, swelling of your legs, ankles, and feet from retention of fluid caused by the failure of the kidneys to eliminate water waste. Unexplained shortness of breath, excessive drowsiness of fatigue, persistent nausea, confusion, pain or pressure in your chest, seizures, coma. Early signs of kidney failure. Symptoms of early stage kidney disease may be difficult to pinpoint. They are often subtle and hard to identify. If you experience early signs of kidney disease, they may include decreased urine output, swelling in limbs caused by fluid retention, shortness of breath. Kidney failure urine color. The color of your urine is a small window into your body's health. It does not tell you much about the state of your kidney function until damage to the kidneys has progressed. Still, urine color changes may be a warning sign of some issues. Clear or pale yellow. Clear or pale yellow urine indicates you are well hydrated. This is the ideal color in most cases. Dark yellow or amber. You may be dehydrated. Try drinking more water and cutting down on dark sodas, tea, or coffee. Orange. This could be a sign of dehydration, or it might be a sign of bile in your bloodstream. Kidney disease does not typically cause this. Pink or red. Urine with a pink tint or a bit of red color have blood in it. It could also be caused by certain foods like beets or strawberries. A quick urine test can tell the difference. Foamy urine with excess bubbles is a sign that it likely has a lot of protein in it. Protein in urine is a sign of kidney disease. Urine color can raise flags or for potential problems. Learn about the common color causes and what's most likely to affect the shade of your pee. Now we will discuss causes of kidney failure. Kidney failure can be the result of several conditions or causes. According to the National Kidney Foundation, the two most common causes are high blood pressure and diabetes. People who are most at risk usually have one or more of the followings. Loss of blood flow to the kidneys. A sudden loss of blood flow to your kidneys can prompt kidney failure. Some conditions that cause loss of blood flow to the kidneys include heart attack, heart disease, scarring of the liver or liver failure, dehydration, severe burns, allergic reactions, severe infections such as sepsis. High blood pressure and anti-inflammatory medications can also limit blood flow. Urine elimination problems. When your body can't eliminate urine, toxins build up and overload the kidneys. Some cancers can block the urine passageways, such as prostate, which the American Cancer Society says is the most common type in men. Colon, cervical, bladder. Other conditions can interfere with urination and possibly lead to kidney failure, including kidney stones, enlarged prostate, blood clots within your urinary tract, damage to the nerves that control your bladder. Other causes. Some other factors that may lead to kidney failure include a blood clot in or around your kidneys, infection, heavy metal poisoning, drugs and alcohol, vasculitis and inflammation of the blood vessels, lupus, and autoimmune disease that can cause inflammation of many body organs. Glomerulonephritis, an inflammation of the small blood vessels of the kidney. Hemolytic uremic syndrome, which involves the breakdown of red blood cells following a bacterial infection, usually of the intestine. Multiple myeloma, a cancer of the plasma cells in your bone marrow. Scleroderma, and autoimmune conditions that affects your skin. Thrombocytopenic purpura, a disorder that causes blood clots in small vessels. Chemotherapy, drugs that treat cancer and some autoimmune disease. Dyes used in some imaging tests, certain antibiotics, diabetes that's not being managed. Diagnostic tests. Your doctor can use several tests to diagnose kidney failure. Some of the most common tests include the following. Urinalysis. Your doctor may take a urine sample to test for anything unusual, including atypical protein or sugar that spills into your urine. Your doctor may also perform a urinary sediment examination to look for red and white blood cells, high levels of bacteria, and high numbers of tube-shaped particles called cellular casts. Urine volume measurements. Measuring urine output is one of the simplest tests to help diagnose kidney failure. For example, low urinary output may suggest that kidney disease is due to urinary blockage, which can be caused by multiple illnesses or injuries. Blood samples. Your doctor may order blood tests to measure substances that are filtered by your kidneys, such as blood urine nitrogen and creatinine. A rapid rise in these levels may indicate acute kidney failure. Imaging. Tests like ultrasounds, MRIs, and CT scans provide images of your kidneys and urinary tract to identify blockages or other problems. Kidney tissue sample. Tissue samples are examined for unusual deposit, scarring, or infections or infectious organisms. Your doctor will use a kidney biopsy to collect the tissue sample. Now we will discuss chronic kidney disease stages. Kidney disease is classified into 5 stages. These range from very mild stage 1 to complete kidney failure stage 5. Symptoms and complications increase as the stages progress. Stage 1. This stage is very mild. You may experience no symptoms and have no visible complications. Some kidney damage is present. It's still possible to manage and slow progression by maintaining a healthy lifestyle. This includes eating a balanced diet, exercising regularly, and not using tobacco products. Maintaining a moderate weight is important too. If you have diabetes, it's important to manage your blood sugar. Step 2. Stage 2. Stage 2 kidney disease is still considered a mild form, but detectable issues like protein in urine or physical damage to the kidneys may be more obvious. The same lifestyle approaches that helped in stage 1 are still used in stage 2. It's also a good idea to talk with your doctor about other risk factors that could make the disease progress more rapidly, such as heart disease, inflammation, and blood disorders. Stage 3. At this stage, your kidneys are not working as well as they should. Stage 3 kidney disease is sometimes divided into stage 3A and 3B, a blood test that measures the amount of waste products in your body helps doctors differentiate between the two. Symptoms may become more apparent at this stage. Swelling in hands and feet, back pain, and changes to urination frequency are likely. Lifestyle approaches may help improve symptoms. Your doctor may also consider medications to treat underlying conditions that could speed up kidney failure. Now we are going to discuss stage 4. Stage 4 kidney disease is considered moderate to severe. The kidneys are not working well, but you are not in complete kidney failure yet. Symptoms can include complications like anemia, high blood pressure, and bone disease. A healthy lifestyle is still vital. Your doctor will likely develop a treatment plan designed to slow kidney damage. Stage 5. In stage 5, your kidneys are nearing or in complete failure. Symptoms of the loss of kidney function will be evident, such as vomiting and nausea, trouble breathing, itchy skin, and more. At this stage, you will need regular dialysis or a kidney transplant. The National Institute of Diabetes and Digestive and Kidney Disease estimates that approximately 1 in 500 Americans is living with stage 5 kidney failure. Now we will discuss about treatment. Several treatment options are available for kidney failure. The types of treatment you need will depend on the cause of your kidney failure as well as the stage. Dialysis. Dialysis filters and purifies the blood using a machine. The machine performs the functions of the kidneys depending on the type of dialysis. You may be connected to a large machine or a portable catheter bag. Along with dialysis, you may need to follow a low potassium, low salt diet. Dialysis does not cure kidney failure, but it can extend your life if you go to regularly scheduled treatments. Kidney transplant. Another treatment option is a kidney transplant. A transplanted kidney can work fully, so you no longer need dialysis. There is usually a long wait to receive a donor kidneys. That's compatible with your body. If you have a living donor, the process may go more quickly. Transplant surgery might not be the right treatment option for everyone. It's also possible for the surgery to be unsuccessful. You must take immunosuppressant drugs after the surgery to prevent your body from rejecting the new kidney. These drugs have their own side effects, some of which can be serious. Talk with your doctor about whether you are a good candidate for a kidney transplant. Life modifications. Minimizing your take of alcohol and making certain dietary changes may help prevent your kidney failure from progressing to a more severe disease. Lowering alcohol intake. If you have kidney failure and drink alcohol, your kidneys will be forced to work harder than they already do. Alcohol does not metabolize out of your system, so you will feel its effect until you receive dialysis to filter it out of your blood. Beer, ale, and wine also contain large amounts of phosphorus. Severe heart issues and even death are possible if your kidneys are unable to filter it out. However, most hard liquor does not carry the same risk. If you have kidney failure or late-stage kidney disease, your doctor may recommend you limit how often you drink alcohol. For some people, completely eliminating alcohol from the diet may be best. Dietary changes. There is no specific diet for people with kidney failure. The guidelines for what you eat will often depend on the stage of kidney disease you have and your overall health. Some recommendation might include limiting sodium and potassium. Keep track of how much of these two nutrients you are taking in. Aim to eat less than 2000 milligrams per day of both sodium and potassium. Limiting phosphorus. Like sodium and potassium, it's good to keep a cap on the amount of phosphorus you eat in a day. Based on a 2019 review, try to stay below 1000 milligrams. Following protein guidelines. In early and moderate kidney disease, you might want to cut back on protein consumption. In end-stage kidney failure, however, you may eat more protein depending on your doctor's recommendation. Beyond these general guidelines, your doctor may also ask you to avoid certain foods if you have kidney disease. Diabetes and kidney failure. Without management, high blood sugar can damage your kidneys. The damage can worsen over time. Diabetic nephropathy or kidney damage caused by type 1 or type 2 diabetes can't be resolved. Managing your blood sugar and blood pressure may help prevent or limit kidney damage. Taking medications as prescribed by your doctor is important too. If you have diabetes, your doctor will likely perform regular screening to monitor for kidney failure. Your risk for diabetic nephropathy increases the longer you live with diabetes. Diabetes is the most common cause of kidney failure. About one-third of adults with diabetes have kidney disease, according to the National Institute of Diabetes and Digestive and Kidney Disease. That's all. Thanks for watching my videos and don't forget to subscribe my channel. Thanks a lot.